So the purpose of the session today is to discuss the Dementia Friendly America model for helping to foster dementia-friendly community initiatives. We'll also look at some specific resources, and I'll highlight some interesting programs that might help to inspire your work, particularly as a community looks at engaging its entire community in the dementia-friendly community initiative. And so the general flow will be to, let's see, TJ, did you share the slides yet actually? Okay, because I'm kind of following along my talking points. Just want to make sure. So the general flow will be to give an overview of the dementia-friendly communities movement and what it means to be a dementia-friendly community, why it's so important. Again, I'll talk about some DFA resources, including some sector-specific resources, and again, looking across the entire community, hearing about those innovative and interesting models. We'll also touch briefly on Dementia Friends, kind of from the broader US perspective. I know there was a Dementia Friends session, I believe, was that yesterday afternoon. And we'll also close with some simple steps on how you can consider getting started in your community. And I do hope you feel free to engage in the chat. We will save time at the end for Q&A, as Kathy mentioned. So throughout the presentation here, I have a few slides that kind of toss some questions to the group here, those of you in the session. So I just encourage you to engage in the chat as you like, so that we can kind of engage with each other throughout and have some interaction that way. So first of all, if you haven't already, you can feel free to introduce yourself on your chat, just, then on the chat, the name, your title, your agency, things of that nature. So next slide. So this next slide lays out why we think demographically dementia-friendly communities are so important. Mary Grace shared some very helpful Washington-specific data at the outset here today, just to add a few additional national numbers. And as you probably know, the number of people with Alzheimer's disease, the most common form of dementia, is growing, with that being estimated as of 2021 that there are roughly 6 million people living with Alzheimer's disease. And I think a stat that not everyone knows, but I think these next two are particularly important. Nearly 80% of people with dementia live at home or with family, and 1 in 5 people with dementia live alone. There are also approximately 11 million caregivers of people with dementia. And another especially pivotal stat, I think, in terms of framing up the importance of dementia-friendly communities, is that 83% of the help provided to people with dementia comes from family members, friends, or other unpaid caregivers, as opposed to care, for example, in residential settings or from professional paid caregivers. So again, that's 83% of help comes from family members, friends, or other unpaid caregivers. And if you add a dollar value onto that, so if you only paid those family, friend, caregivers $12 an hour, which we know is below the living wage, and the Alzheimer's Association also estimated that the average caregiver of somebody with dementia spends 22 hours per week on their caregiving responsibilities. So if you kind of do the math, that multiplies out to a value of $232 billion annually, which I just think it just kind of shows the impact of caregivers on society and the importance of their role. And I think that was really elucidated through the keynote presentation today too, which painted such a powerful story. And finally, one more data point I just wanted to mention: 83% of people with dementia, according to a study, switched their shopping habits to places that are more accessible and more dementia friendly. So again, I hope some of those stats help to point the case to why a community should become more dementia friendly. And next slide. But beyond the data, and data is always helpful, but we also want to hear input from people living with dementia. What do people with dementia want? And according to the Global Charter on Dementia, which was developed by individuals living with dementia, the central tenet is that, and probably no surprise, individuals want to live well with dementia. It's not always easy, of course. It can be challenging at times, but DFA is on a mission to help support people in their aims to live well with dementia. Next slide. So let me share a little bit of information about Dementia Friendly America. I think I've already called it DFA for short. So if you've heard me say DFA, I'm referring to Dementia Friendly America. I'll try to use the full term, but sometimes I forget. The goal of Dementia Friendly America is to ensure that communities and individuals across the U.S. are equipped to support people living with dementia and their care partners. And DFA was built upon a successful model in Minnesota that started some years back now called Act on Alzheimer's. And that model, Act on Alzheimer's, was having a lot of success in fostering dementia-friendly communities across the state of Minnesota. And so much so that it got substantial attention, and folks really looked at how can we come together and help bring this model out to other states across the country. And there were pockets across the country that were engaged in other in dementia friendliness as well. I think Wisconsin and Massachusetts was an early starter as well. But really, how can we spark a nationwide movement building upon this great model and resources that they developed? So there are two primary initiatives within Dementia Friendly America. One, as I kind of just mentioned, based on the Act on Alzheimer's model, is to help spread and support dementia-friendly communities across the United States. And I'll talk in a minute about what a dementia-friendly community is. But also to raise public awareness and reduce stigma through the Dementia Friends USA initiative. And I put a little infographic on this slide because sometimes the wording is so similar between dementia-friendly communities and dementia friends that it can be confusing. But I always remember the word friend in Dementia Friends. So the Dementia Friends program is aimed at the individual level. It's aimed at raising awareness among individuals. And dementia-friendly communities is all about community-wide impact, bringing multiple partners together across multiple sectors of a community to help foster a more dementia-friendly community. And I'll talk a little bit more about both of these and also how they interweave and can mutually support each other, because I know Dementia Friends is active in Washington State. So you can go to the next slide. So what is a dementia-friendly community? There are different definitions as you look internationally because there are dementia-friendly communities, in fact, all across the world, which I think is really cool to think about. They're very active in the UK, in Canada, and Japan, but as well as really countries all over the world across, basically all the continents. But a dementia-friendly community, and the term that the definition that we use is one that is informed, safe, and respectful of individuals living with dementia, their families and care partners, and provides supportive options that foster quality of life. And so there is an option for a dementia-friendly community initiative to join the Dementia Friendly America network of communities. And that means that community is working on a process to become more dementia friendly. And that their mission aligns with our mission, basically, and their model aligns with our key principles of dementia-friendly communities. So we do have 6 key goals that we've outlined for dementia-friendly communities, and these are based on some of the latest research that we were culling together, both research from the U.S. and abroad. And I'll just share some of these. But key goals of dementia-friendly communities, and this doesn't mean each community is working on all of these at the same time. Sometimes a dementia-friendly community might start with 1 or 2 goals that they're working upon and perhaps work on other goals later on, depending on what are their strengths and perhaps weaknesses within their community. But again, key goals include increasing awareness and understanding of dementia and the impact of it on people living with dementia. That's oftentimes where the Dementia Friends program can be a really helpful tool for increasing awareness and understanding of dementia. Another goal is increasing awareness and understanding of brain health and risk reduction. Another goal is to collaborate with public, private, nonprofit, and healthcare sectors. Another goal is to address the changing needs of people with dementia and care partners. Another goal is creating social, cultural, and business environments that are inclusive. And finally, improving the physical environment in public spaces, places, and systems. And often a question that comes up is, how do we know we're making a difference as a dementia-friendly community initiative? It's I think something that's important to bake in as early as possible in a dementia-friendly initiative is to establish not only your goals, again, which oftentimes they align with those that I just read, but how can you evaluate the goals and the activities that you align with those goals. So we did publish an evaluation guide, and that's on the DFA website, dfamerica.org, that outlines various tools to help guide communities through that process. All right, so let's see. I just noticed because I'm following on my PowerPoint. So I did notice is my camera up on the chat on the screen? If there's anything I need to do on my end to get my camera up, just give me a shout. I'll keep going. Hopefully it's right from your all's end. Principles of and you can go to the next slide, TJ. So let's look at principles of dementia-friendly communities. This slide highlights overarching principles and goals that communities should keep in mind as they create a dementia-friendly community and, again, evaluate their activities as well. So the number one principle, which is really just consistent throughout all the literature and throughout DFA and our core mission, is to include and involve people with dementia in meaningful ways in the community effort. They provide valuable information and intel really on what is working well in a community and what needs to change. This can be, their involvement can be through things such as participating on an action team, but there are a lot of different ideas, and I'll share a couple in just a few minutes. But you'll see if you look at this slide that the action wheel, and this, again, this wheel represents common members and how to structure a dementia-friendly community action team. Really, and you'll see that in the next goal, the next principle as well. Establish and maintain a team that works collaboratively to create change. So a dementia-friendly community initiative really can't be led by just one person or one agency, because it's about community-wide change. So bringing team members together from across various sectors. But you'll see at the center of this action team, with all the partners kind of wrapping around, are people living with dementia and family caregivers as well. So you can go to the next slide. Dementia-friendly communities working across community sectors. So Dementia Friendly America promotes the idea of working across community sectors. And our vision really is that every part of a community can play a role and could work together to take steps and help foster that dementia-friendly culture. And that's what this cloud image tries to represent, how each different sector of a community can play a role in a dementia-friendly community effort. So just for a few brief examples, and then I'll go into a little bit more detail later, but businesses, for example, banks or retail, any number of businesses can support, for example, customers living with dementia by having trained staff who know about dementia and know some basic skills on communicating with somebody who may have dementia. And employers can also support employees, for example, who are care partners. Healthcare systems can promote early diagnosis and help connect people to community resources. Communities of faith, which also came up earlier in the keynote and opening remarks, can provide welcoming and engaging environments for those with dementia. Local governments play such a critical role, as well as community-based organizations and aging services providers. This really cuts across multiple sectors, because oftentimes you see housing and transportation and public spaces and emergency response all kind of tied through local government. Neighbors and community members, as well as residential care. Next slide. So this slide outlines a few key steps that communities, that basically DFA suggests, Dementia Friendly America suggests, as you're working on a dementia-friendly community initiative. These are some key steps that can help bring together community sectors to achieve the change that you're hoping to achieve. So, and we have a lot more information on each of these key steps on our website that really details the process, the steps in more detail, as well as specific tools and like attachments for each step. So just be aware of that. It's on our website under DFA Community Toolkit. But the basic phases are to convene key community leaders and members to understand dementia and its implications for your committee. So this is kind of where the action team is formed. That's where it's really critical to include people living with dementia and care partners. By the way, you don't have to call it an action team. Plenty of communities use another term, steering committee or task force or working group or some such thing. The next step would be to engage those leaders as well as the broader community to assess current strengths and gaps in your community. So again, we have various tools there, but that could be through focus groups or discussions or bringing people together in a virtual or, when it feels safe, in-person summit. We also have surveys that can assist in that. Sometimes they're distributed online. Sometimes they've been distributed through community convenings. It just depends on your community and what works for you. But then to analyze that data and determine the issues stakeholders are moved to act upon. And stepping back up a moment to engage in assessing current strengths and gaps. Oftentimes communities are coming together with a lot of data already in hand. For example, from the work of their area agency on aging or local government partner, et cetera. So in many instances, you don't have to start from scratch on that engagement phase. You can use information that you already have on hand, but look at it through the lens of what do we want to act on with regard to a dementia-friendly community issue. But the analyze phase is really where you kind of pick your priorities because you can't necessarily do everything all at once. So what are the key goals that stakeholders are committed and ready to move upon? And then acting together to implement those activities. And also, as I mentioned, to think about evaluation and really baking that in from the outset as well. Next slide. So this slide just highlights in the bullet points, really, some additional examples of resources that we have on our website in case you'd like to check it out. Beyond that 4-step community toolkit that I mentioned on the last slide, we also have sector guides and videos and tools geared for providers, including healthcare providers, and videos geared for healthcare providers, as well as a resource listing. And these resources are all free. Many of them are in documents, so they're downloadable. Many of them are in Word, so you can edit them to meet your needs. So encourage you to check those out. And our goal at the national level is basically to help communities by laying out a roadmap. And then the community initiative can pick and choose the pieces that you need to help you on your project. So it is aimed to guide communities with enough structure to help communities come together and create a shared agenda, but flexible enough that it allows the community to define their own goals and approach the work in the way that's most suitable for that community. Next slide. In this section, I wanted to just share a little bit more detail on the sector guides that I mentioned just a moment ago. So as you have seen on that action wheel, where it's the kind of hub and spoke, where it has different key partners that you can engage in a dementia-friendly community initiative. And please know that there are other partners that we might not have specific sector guide resources yet for. Periodically we add new sector guides, but please don't consider this an exhaustive list. It's not exhaustive. Plenty of dementia-friendly communities engage with different partners. You just heard Jan Doherty on the keynote discussion section talking about airport work. That's certainly been an area that some communities have engaged in. But these sector guides provide some kind of like the essential info on how to prepare and to engage with this sector. What information that might they need to learn so that they can respond to people with dementia in their specific sectors. And they provide guidelines and tips and practices for becoming dementia friendly, and things like communication tips, kind of customized to the different sectors, since they're overall tenets that kind of remain the same, but at times also things that you want to customize to make them particularly relevant. So we have sector guides for each sector on that hub. So it's like banks and community members, legal services, local government, healthcare and hospitals, faith communities, libraries, businesses, community-based services, and residential care. It's all of them. So next slide, and this is the first chat question, and I'm seeing some engagement on the chat. I haven't had a chance to really look at it too much, but thanks. I see quite a few folks introducing themselves, but a question for the chat, and you can just reflect on this now or in a few minutes as it comes to you. But feel free to share, why do you think dementia-friendly communities are important? Maybe you have a personal perspective or a local experience or anything of that nature that you'd like to share. So next slide, I wanted to circle back to one of those key principles that I touched on a few moments ago. And that the first principle of the Dementia Friendly America model and dementia friendly communities was to include and involve people living with dementia in the effort, again, in a meaningful way. So what are some ideas on how to do that is a relatively common question. I think there are a multitude of ways. And, as you may develop a local effort, you may think of other ideas. So I would love to hear those ideas too. But one essential mechanism is through the action team, or again, you can kind of call it what you wish, steering committee, task force, et cetera. But the action teams are instrumental to guiding and shaping the dementia-friendly community initiative. And I think to be effective and to be authentic, they need to include the perspective of those with dementia and their care partners. So this is where it really comes to thinking about outreach to effectively recruit individuals living with dementia, and thinking about care partners that you may need to have at the table on the action team to help you make those outreaches if perhaps your agency isn't directly connected to people living with dementia. So it might be through the Area Agency on Aging or the Alzheimer's Association, or even home care or senior living or memory cafes or early stage support groups are all settings where you might want to have a discussion about starting a dementia-friendly community initiative. And is anybody interested in being involved? I think the other thing it's always important is to consider dementia-friendly meeting principles. And you can go to the next slide for a little bit more detail on that. There are some great resources out there on dementia-friendly meetings. The one I have and the image of in this slide is through the Dementia Alliance International. And we have a link to that on the DFA website, but just some simple tips. And some of these more apply for in-person, but you might want to think about how they translate to a virtual event. Or even a telephone meeting, but avoiding late afternoon or evening meetings, offering to provide an assistant to assist with travel to the meeting if it's in person, or perhaps someone to help test out virtual tech in advance. Ensuring staff supporting the event have knowledge about dementia and know simple tips for communication. So perhaps those staff are dementia friends, for example. If in person, ensuring there's clear signage is important. Using respectful language, not suffering from, for example, not saying this person is, suffering from dementia. Also remember that people with dementia have the choice, as we all do, to decide how much we want to disclose about ourselves. So they may choose not to disclose their diagnosis. Maybe they are contributing based on their prior life experience. They ran a business in the past, or they were or are a faith leader. So just making sure that communication is clear, so you're not deciding how somebody communicates their role for them. And also, again, for in-person meetings in particular, it can be helpful to have a spot that's a little bit quiet if somebody needs a break, set aside for people with participants with dementia. And some folks might feel more comfortable speaking up in small groups or in one-to-one. So also thinking about opportunities to engage input in those ways as well. Beyond the action teams, and you can go to the next slide, there are some other good ways to activate people living with dementia. So one idea that I love is co-facilitating trainings. So that can be a co-facilitator living with dementia, speaking about their experience at the beginning of the session, kind of providing that context. And then perhaps the staff or other volunteer delivers the presentation slides. Also examples where the co-facilitator living with dementia and the other speaker, volunteer, et cetera, co-present and kind of share the remarks back and forth. So, I mean, however you can engage and however the person's comfort level is. But I think the feedback that we've heard through dementia-friendly communities that do this is the more involvement, the better, again, depending on that person's comfort level and preferences. But the evaluations folks have gotten when they've had co-facilitators living with dementia is just really powerful. And folks say that, like, that perspective really made the training and made the difference and the impact. Next slide. Also, a cool idea that some communities have done, and I'll talk about dementia-friendly business initiatives in a few moments when I get into other interesting kind of programmatic examples. But doing a dementia-friendly business initiative is kind of a fairly common activity amongst dementia-friendly communities. And what a handful have done is include a visit from a volunteer advisor who's a person living with dementia, perhaps 1 to 3 months after that business receives its dementia-friendly training. And so in this setup, a person living with dementia or a care partner visits the establishment to observe the strategies being used to support people living with dementia and provide feedback. And it's not meant to be a gotcha or anything. It's discussed up front as the business is kind of brought on board for the initial training. But it's just about how to identify areas to improve and to think about needs for any follow-up trainings. And I also think thinking about volunteer opportunities beyond this kind of friendly visitor or volunteer advisor. One of my first experiences, I think about 18 years ago now, was when I was a volunteer at the St. Louis Alzheimer's Association, where I supported an early stage telephone support program where people with early stage dementia called others with early stage dementia in the community to really help address isolation that people feel when they have dementia and they might not be going out as much, and also the dynamic of COVID. So I think also thinking about those volunteer opportunities is really neat and very impactful. Next slide. So another chat question for the group. And I would love to learn some additional ideas. So do you have any other ideas or tips for engaging the leadership and involvement of people living with dementia in a community effort? So whether you're involved with the dementia-friendly community effort or not, what other ideas might you have to help facilitate involvement? I'd love if you shared them with the chat. Next slide. So this is when I kind of pivot to more discussion on engaging the entire community. I do have some videos in this section of the agenda, hopefully help break things up. So let's go to the next slide again. But just to start, dementia-friendly choir. There's some really cool examples out there and also really cool transitions to virtual. I tried to get a video, because I have a video on the next slide, with a kind of virtual adaptation of a choir. I wasn't able to do that, but if you Google virtual dementia-friendly choir, there are some really neat things out there. I can maybe send a link in the chat if I have a moment during the Q&A. But a dementia-friendly choir doesn't mean it's a choir just for people with dementia. It means that it's a place that's friendly for people with dementia. And the same can be said for other things like a dementia-friendly business. So how are ways that a choir can be dementia-friendly? It's thinking about when the rehearsals are held, like during the day versus later in the evening. Perhaps looking at the venue. Does it have good access, mobility access? It's thinking about the music. It might be more difficult for people living with dementia to learn a new repertoire. So there might be a focus on singing songs which are typically familiar. It might be looking at a repertoire from an kind of earlier time frame, or looking at more traditional music, such as Christmas Carol, kind of traditional Christmas carols in the holiday period or some such thing. Of course, there's a focus on singing, but it's also a focus on being supportive and maybe, kind of on the more informal side of things and relaxed and friendly, and making sure to value the input of all the participants. So if somebody has a suggestion for a song or a stylistic suggestion, valuing all that input equally, and also having that social aspect to that as well. And just again, with a more relaxed pacing, just giving time for people to have those social connections, again, whether this is in person or virtually. So let's go to the next slide, which is a brief video. I will say, TJ, don't play the video quite yet. This video is a little pixelated. The audio should play clearly, but if it's pixelated, it was happening yesterday too, so it's no surprise. Just go with us, but I think you'll hear the content and enjoy that. So go ahead, TJ.
There has been some emerging research about music and the brain. And what people have learned is that people with Alzheimer's actually retain music memory in a part of the brain that's last affected by Alzheimer's disease. Alzheimer's is a progressive but fatal brain disease that impacts people's ability to function on a daily basis. Things that you used to be able to do, you can no longer do.
As someone who has Alzheimer's, it's you have a fear of not being accepted. And here, we're all accepted. And we all have problems, but that's all right. We're all here together.
Thanks. I just thought that was a good little snippet. Again, there's some really cool virtual ones that I was just watching last night that are just so cool to think about how people are engaging in like new and innovative ways. But you can go to the next slide. So this is on faith-based engagement opportunities. I think there were some great examples earlier from Lou Rochelle, where she talked about her mother getting greeted at the church by folks that would then bring her to the Sunday school and then bring her up to the services and then wait with her. That I think is like the second bullet point on this slide, like buddies, to have somebody to help accompany the person with dementia. Maybe the person isn't able to sit through the full service, but the caregiver wants to sit through the full service. And so the buddy can help out and give that person, allow the caregiver to attend the full service and give a break to the person living with dementia. We've also seen some faith communities that hold special services that are maybe shorter, a little bit more streamlined. Some that have had special choruses, also that they can be really great sites for hosting memory cafes, which I'll talk about in a little bit more detail in a minute, or support groups for care partners and for people living with dementia as well. There's also a really great program called the Alter program out of Emory/Georgia State University that focuses on dementia-friendly congregations, specifically congregations that are primarily African American. And they have some great resources. Next slide. I just thought this was a neat program. So, and I think, the Detroit Zoological Society partnered with their local Alzheimer's Association to bring its Community Connect program to the Detroit Zoo. And it basically provides an opportunity for socialization and culturally significant events and outings for people living with dementia, and as well as their care partners. And just kind of like a fun learning experience that included a tour and conversations with animal care staff and ability to walk around the zoo. And I think I'd heard that in Seattle, the Woodland Zoo had a similar program. So I wasn't sure if that was still active, but some of you may know. Okay, yeah, the Woodland Park Zoo Walk. So that's cool. I think it just kind of speaks to there are opportunities to partner, whether it's with, a zoo, but it might be partnerships with other kind of recreational settings or even like historical societies or things of that nature that, and especially those that have the outdoor aspect, maybe they have been on hiatus during COVID, but I just think there are a lot of opportunities with things of that nature. Next slide. Also kind of, staying on the social engagement aspect, there's a neat project called the MoMA Alzheimer's Project. It was a special initiative out of the Metropolitan Museum of Modern Art in New York. But again, I think it can parlay really easily. You don't have to have like a huge MoMA museum in your backyard. You might have a smaller local, maybe history museum or historical society that could do something similar. But they have a lot of great resources. We link to them off of DFA. It's all about supporting arts professionals and helping to make art accessible to people with dementia using some specific kind of tools and methodologies and approach. So I just wanted to mention that as a resource. And similarly, the National Gallery of Art in Washington, D.C. developed a program called Join Us. That's where the photo's from. But it's a arts-based program, again, for people with dementia and care partners, aimed to just create a positive experience and a setting for people to enjoy art. The National Gallery can get really busy sometimes, so they have specific meeting times when the museum's a bit more quiet and where they can have more of a peaceful discussion without all the hubbub that can happen, especially on weekends. And so they just foster some discussion with questions where there's no wrong answer, because I think that's the beautiful thing about art. So they just kind of say things like, let your eyes wander over this painting. What do you notice? Where are we? And a variety of questions like that. And they kind of group them on different themes. So one day might be looking at paintings that pertain to water, and another day might be on a different theme. Next slide. Similarly, we've had quite a few communities engage in things like dementia-friendly film, or other arts events like some, dementia-friendly symphonies and the like. So just to share a few tips, with a dementia-friendly film screening, you can do things like kind of leave the lights on low. Sometimes that pitch black room can be difficult for anyone to navigate, but also if somebody needs a break mid-screening, or just to help see the signage that perhaps is out there for going to the restroom or other such things, making sure that it's known that it's okay to move around or even engage, like sing along if it's a musical that's being filmed. There's no wrong here. I think we've heard that sound needs to be a careful consideration, like raising the volume too high can be a little bit stressful and kind of overly stimulating, but also counterbalancing with those who might be hard of hearing. So that's where just having an open feedback loop and kind of listening to the majority, in the sense of if most folks say it's too loud, then in general, it's probably too loud, but making sure there's a feedback loop, especially if you're looking to have maybe a couple or a handful of dementia-friendly film screenings, or make it some type of ongoing event. And also training staff. It's a great way to, if you're having staff or volunteers help with this type of screening, encourage those folks to become dementia friends. So again, they have that awareness of dementia and they know the basics and communication tips and things of that nature, and clear signage again, which is kind of a theme throughout a lot of these, which is having clear signage. And we can give some more specific tips and tools on that as well. So I think I'm running long. Let me talk about a memory cafe. You can go to the next slide. Memory Cafe is a safe and a comfortable space where caregivers and loved ones can socialize and listen and play, listen to music, play games. They're held in a variety of settings. So this is often where, again, it's a great way to engage different sectors of a community. A memory cafe can be held in a library or a senior center, or really any place that has a public setting to engage in. And they're supportive places for both people with dementia and care partners to engage with others that are on similar life journeys. Just so we keep on time, and I want to have time for some Q&A and dialogue. So I think, TJ, hold off on the videos and I can make sure folks get access to those afterwards. Guess I'm being more long-winded than I anticipated. I apologize. Libraries are also great opportunities for engagement in a dementia-friendly community initiative. So again, it's a great way to train staff and volunteers, help them become more dementia-friendly, help them become dementia friends. Think about library materials that are aimed at caregivers of people with dementia, but also materials that can engage and stimulate those living with dementia. We've seen some libraries offer individualized appointments, and also certainly libraries that have, a special display during the month of September, for example, or have memory boxes or kind of reminiscence kits for patrons to check out. I know there's actually a special section just on libraries today, so there are lots of interesting ideas there. The next slide is on businesses. There was a video here, so that's why it's a black box. But again, keeping in mind that 83% of people with dementia have switched shopping habits to places that are more accessible and more dementia friendly, I think again points to the need to help foster business relationships in a dementia friendly community initiative. So again, a dementia friendly business is one that's trained at least 50% of its staff on dementia. They've taken a look at how their physical environment can be more conducive and safe for somebody living with dementia, how you communicate with somebody living with dementia, and are maybe aware also of local resources pertaining to supporting people with dementia as well. Next slide. There are also a lot of really cool examples related to intergenerational examples. There's a dementia-friendly high school example in Massachusetts where they it was like a trade school where students learning about like nursing and catering and others that were kind of trained specifically on dementia, since many of their careers might lead to, say, providing nursing services in a nursing home or catering services in a variety of settings where they might encounter people with dementia. So I thought that was a really neat example, but there are plenty of others, whether it's Youth Movement Against Alzheimer's, which has partnerships on college campuses, or various books aimed for younger youth, such as Grandpa and Lucy, where some communities have used it in like fostering discussions with younger youth, or even as a tool within the Dementia Friends program, but Dementia Friends can actually be adapted to young audiences, even as young as middle school. There's also a wealth of examples of dementia-friendly banking initiatives. So Wisconsin had a train the trainer model where they trained leaders in certain local banks that on dementia. And then those leaders trained like the other branches in their banking network. And they learned the basics about dementia and how you might identify somebody with dementia, particularly in a banking setting, such as confusion with payments and documents, or checks not being filled out properly, or those kind of concerns about how money is being used by a third party or the like. Next slide. Oh, next slide again. Training for first responders is a very common activity as well that I think is really important. First responders tend to encounter people with dementia in a variety of settings, whether it's wandering, driving, 911 calls. So it's really helpful and important for law enforcement to have information on dementia and signs and symptoms. I think you might have seen the news story in Colorado a few weeks back where a police officer got really, really rough with an older woman with dementia because she didn't respond as that police officer might have expected. She didn't respond as quickly. And so how can we help make sure law enforcement is more dementia friendly? And again, there are a lot of great collaborations between law enforcement and dementia friendly community initiatives, and a lot of great resources also on our website that either we've developed or we link to. Next slide is on healthcare. And this could be also a whole standalone session. Pretty much any of these sectors could be, but this one is particularly meaty because it covers a lot, whether hospitals, primary care, pharmacies, or even dentists. We've seen quite a few, or at least a handful of dementia-friendly community efforts partner with local dentists because we know dental care is such a need, especially for people with dementia where it might be more difficult to serve them. So there's a lot of innovation here. And a lot of just ongoing need. We know dementia continues to be underdiagnosed, and when it is, often there's not that connection to community supports. So always think about healthcare partners as you're looking at a dementia-friendly community initiative. Next slide is just a quick snippet on environmental design and looking across sectors. Like, this woman here is holding up some clear signage. It's helpful to have colors that kind of distinguish, words that distinguish. It's more helpful than saying having a hen and a rooster, where I know it takes us all a moment to figure out which toilet am I supposed to use with things like that. So always thinking about environmental, and there are a lot of great checklists that can help groups look at environmental design and how it can foster dementia friendliness. Next slide. Okay, let's go along to the chat question next. So what creative ideas could happen in your community to support people with dementia? We'd love your participation in the chat with any ideas you have. I just covered a few of the ideas that I'm aware of today. I'd love to hear your ideas. Next slide. Now, I know you had a Dementia Friends session at the beginning of this conference, so I won't spend a lot of time here other than to say Dementia Friends is active across the USA. There are over 100,000 Dementia Friends in the US. It's all about raising awareness, reducing stigma. Next slide. And you can become a Dementia Friend either online through our website, which you can see a screenshot of our website there, or through attending a live session. And that's what the Washington State sublicense and it permits is live sessions, either virtual or in person, to have a 45 to 60 minute information session to learn more about dementia, including communication tips and the like. And the next slide shows where is Dementia Friends all across the country. So again, you know that it's an active program in Washington State. It is a sub-licensed program, so there needs to be one lead agency per state. So if you have family or colleagues in other states, you can see from this list where it's active. And our website, dementiafriendsusa.org, also has more information. Next slide. This one just shows some of the images of these Dementia Friends sessions. They have been converting to COVID, since 2020. So these are not COVID photos, but the COVID sessions, the virtual sessions still have a lot of engagement, and it really gets people inspired to get involved. So TJ, you can go 2 more slides and I'm just nearly wrapped up here. So Dementia Friendly America, we provide technical assistance, tools, and resources. Next slide. So what are some simple steps to getting started? Because oftentimes that's a question. So again, joining DFA means a community is working to become more dementia friendly. It doesn't mean that you're at the end of the process. Typically, it means you're somewhere near the beginning of the process. There is an application form, so you have to have given some thought to be able to fill out the application form. Most importantly, it's helpful to define your community. How you define it is up to you. It could be a city, it could be a county, it could be a kind of region or a cross-county partnership. And sometimes we've seen communities where it starts smaller and then it grows, and that's fine too. One key step is to review the community toolkit online. Some communities do a very step-by-step approach. Others pick and choose the resources that are most helpful for them to use. And I think it's always very, very helpful to identify who are the passionate individuals in your community, and also who are some movers and shakers that you need to have on the agenda or have on the action team. So thinking about those folks right at the outset is really important, and also connecting with us for technical assistance and support. And on that note, you can go to the next slide, which is about how we support communities. Dementia Friendly America materials are free, they're downloadable, they're customizable. And when a community joins the DFA network, you then get access to some additional tools, such as the ones that are listed on this slide here, such as a Google group we have for connecting with others, some TA, access to branding, and the like. And that brings us to our final slide, which is just my contact information. And I believe we still have a little under 10 minutes left for Q&A. So I will toss it back to Kathy.